Hello.
Hi.
Hi. What is your name?
Grace.
Hi, Grace. My name is Michelle, and I'm going to be your nurse practitioner from DMP from Brandman University. And I'm here, I understand you're here for a wellness check. Is that correct?
Mm-hmm.
Okay, great. Now, Grace, can you tell me what is your day of birth?
It is January 15, 1991.
Okay, great. I was reviewing your chart and I realized that they have already accomplished your bios earlier, and also I checked to look at your BMI and its normal limits. So with that means that for your height and your weight, we're all good. So for purposes of this video, I'm just going to run through it, and we're going to start with things that has to do with the one side of her body. I will be looking at the cranial nerves from 1 through 12. So first, I'm going to start with Grace with her top of her head, and also I want to make notice too that privacy has been ensured, and I've already washed my hands as well too, and the lighting has been completely done, and the curtain has been drawn as well too. All right, are we ready, Grace? All right, it's good to know. So I'm going to look at first. I'm visualizing Grace right now. And it looks like Grace, she has, she's within, like as I mentioned before, her BMI is correctly within normal limits, and nutrition is appropriate as well for her height and weight. It also appears as too that her skin is appropriate for her ethnicity. It looks like it's right coloring, and I'm looking at her face as well too. I noticed that she has some moles that are there. When I looked at her chart, I noticed that you also had 20/20 with the glasses, so I do see the glasses on your face as well too. And Grace, as we go through this, if you have any pain or discomfort, you'll let me know. Do you have any pain currently right now?
Mm-mm.
Okay, you don't. Good. So if I may, I'm going to go ahead and look at your hair first. And looking at Grace's hair, it's beautiful. It's nice and shiny. I noticed that it's evenly separated, but at the right appropriate length. And towards her chin, I don't see any scales or scabs, or I don't see any lice or scabies at all within her hair at all. And she hasn't had any problem with her hair in the past at all. Okay, great. And then what I'm going to do now, I'm going to look at her skin. Like I said, her skin looks like it's smooth. And if I may look at your hand here, I'm going to look at her fingers. I notice that with her fingers, her skin is moisturized. There's no tinting. I'm looking at her fingers as well, and I'm pressing it for capillary refill. That's within 2 seconds, which is normal as well too. And it looks like it's evenly distributed as far as her coloring as well too. There's no clubbing with her nails at all as well too. So now I'm going to go ahead and move to the next point, where I'm going to, at this standpoint right here, I'm going to look at your eyes. If I may take off your glasses, Grace. Okay, I'm looking at her eyes right now, and it looks like her eyelids are symmetrical, and her eyelashes are in place. There's no missing lashes at all whatsoever, and her eyebrows are as well too. I'm going to pull up her eyelids and look at that. Look at her sclera and also her conjunctiva. Yeah, it looks like it's pink and shiny and no drainage at all whatsoever. Nice and bright and white as well too, which is good. And then I'm also going to, now if I may, I'm going to go ahead and look at her eyes. And I'm going to come over on this side if I may, Grace. And what I would like for you to just look at me this way right here. I'm going to have this pin light right here, Grace. And what I want to do first of all is I want you to look at me. And then what I'm going to do is I'm going to check to see if you see anything right here. Do you see my hands here in peripheral?
Mm-hmm.
Okay, great. And now I'm going to check to see concentral, if you're able to check this pin here and see if your eyes come in and cross. All right, good. So it looks like that's with the normal limits too. And now I'd like you to look at this pin and then look behind me as well. Great. I see that's reactive and well, so that's good to see. Now what I'm going to do is I'm going to put this light in your eye, and I'm going to hold it here. Great. And I'm going to do the same way here. Excellent. So her eye pupils are reactive, and that's a good thing to see right now. I like to see that with all of our patients that we have here. And are you still okay, Grace? No problems? Okay, that's good to know. And so now what we're going to do, I'm going to have you to follow, and I'm going to be checking the cranial nerves 3, 4, and 6. And what I'd like you to do is just follow this motion if you may, okay? You're going to go up, you go down, great, and up this way, great, and one more time. Awesome. So cranial nerves 3, 4, and 6 are intact, which is normal. That's great. And now I'm going to go ahead and check cranial nerve number 5. And I'm checking for your TMJ to see if it's in clicking. I'd like for you to go ahead and open your mouth. Close your mouth. Good. No crack, no clicking at all whatsoever. Great. And now I want to go ahead and look at cranial nerve number 7. I'd like you to open your mouth, stick out your tongue, say ah. Okay. All right. Great. Now take out your tongue and move it around for me. Okay. And I'm looking also in her mouth, open wide. And it looks like her uvula is center midline. It looks like as if her teeth, open again one more time. They're bright white. I don't see any cavities. Perfect dentation. No great hygiene. Nothing is broken or chipped with her teeth, and that's good to see as well. Good job with that, keeping your teeth clean. And now what I'm going to go ahead and do is I'm going to just check her lymph nodes as well while I'm here, and I don't feel any swelling or any problems here. Have you had any swelling and been sick lately? Okay, that's good to know. And while I'm here, I'm going to go ahead and check your thyroid as well too. So Grace, I'm putting my hands here, and what I'm doing is I want you just to go ahead and swallow for me. All right, that's great, perfect. And you're still okay with me? That's good. That's good to know. So now what we're going to do is we're going to go ahead and look now into your ears. And with the ears, that's going to be your cranial nerve number 8. And what I'm going to do with looking at your ears, before I look into your ears, I'm going to first inspect them. If I may move your hair over, I'm looking at her pinea, and everything looks to be normal. It's normally symmetrically. Both ears, look at this side here. Both are symmetrically. I don't see any drainage. I don't see any abrasions. I don't see any leakage at all whatsoever. So now I'm going to raise her, take her pinea, raise it up, look into her ear, and I see her tympanic, and it is shiny and gray, and also I saw the cone of light, and that's very good to know as well. And now I'm going to go ahead and I want to look in your nose, but before I do that, I want to check the patency of her nose. So how I'm going to do that, and if I may, over here, Grace, I want you to hold one side of your nose, please, for me. Can you smell this? What does it smell like?
Alcohol.
Okay, hold the other side, please.
Alcohol.
Okay, that's good to know. When you want to know, make sure you can smell the scents, the smell. Now I'm going to look at her nose. I'd like you to hold your head back for me. All right. So I'm going to anchor this again. All right. So it looks like her sinuses, her noses are patent and open. I see that I ain't seeing her septum wasn't deviated. Their mucus was clear, no drainage there with that. You had no problems with that as well too. All right, that's good to know. And while I'm doing this, I'm gonna go ahead and check your sinuses. Have you had any problems with your sinuses before or anything? So I'm checking her frontal sinuses, her ethmoid, and her maxillary. Okay, and I was feeling puffiness or tingling or anything like that. So we're good to go with that as well too. So that's great. With cranial nerve number 7, I'm also going to have you to raise your eyebrow for me. We're checking it's good. And I want you to smile. Blow your cheeks out like this. And pop it. Awesome, that's great. So your cranial 7 nerve is intact as well too, which is good to know. And then now what I'm going to do also is I'm going to have you open her gag reflex was checked, and it's within intact as well too, because she's able to speak and talk effectively, so there's no problem with that. So now with this, what I'd like to do, Grace, if I may, I want to go ahead and check her pulses that we have right here. I'm going to go ahead, since we've already checked her hands before, her skin, I'm going to go ahead and check her radio. And those are some strong pulses out there right there. That's good to know. And then I'm going to go ahead and have you lay back. Can I help you here? Awesome. And I'm going to put this out here for you as well. So I've already checked the radial and the brachial, and they're strong and equal. Now I'm going to check her femur. That's strong. Her popliteal, which is strong. And her dorsal pedal. Very good. That's strong as well too. All right. That's good to know. And while I have you here, Grace, what I'm going to go ahead and do is I'm going to go ahead and listen to her lungs right now. And I'm going to go ahead and check her brewery as well too for cardiac artery. I'm going to go ahead and check the cardiac artery pulse as well too right here before I check her lungs. And that's strong as well too. They both are bilateral strong equally. So now I'm going to go ahead and listen to your lungs. Now, have you had any problems with breathing before in the past? You can lay down if you want to, but since you're already up, that's fine. Have you had any problems with breathing? No. Okay. So normally I would just do both sides equally as far as when we listen to the sounds, breath sounds. And there are 8 parts that I want to listen to. And it will be in the front and the back. And what I will do with Grace, we'll go ahead and have her breathe in and breathe out. But for purposes of this video, I'm going to have her just do the one side in that sense and show you the points. So it'll be here, in and out, here, in and out, here, in and out, here, 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 and right here, and right here. And then we'll turn around also in the back as well too. We're going to angle a little bit to myself, but we will also do it here, breathe in and out, right here, 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 in and out, and right here, and right here. And that's what I would do. I will also then, while I have her, I will inspect her. I will already have inspected her back and making sure that it's symmetrically evenly. I don't see a barrel chest. I don't see her hunched over. Her posture is very good. So therefore, that's consistent with her breathing sounds, which are even and unlabored in that regard, which is good to know in that sense. So now, what I would like to do is I'm going to have you go ahead and turn around. I'm going to move this pen light right here out of your way. And then I'm going to go ahead and have her to look at making sure at her chest. And like I said, with her chest is the diameters are even and completely the same and symmetrical. The ratio is 1 to 2. But I'm going to go ahead and listen to her heart sounds. And so, have you had any problems before? Has anyone ever said you had a murmur or anything like that in the past? Okay. All right. So what I'm going to go ahead and do is I'm going to start here with the apical. So the apical, pulmonic, herbs, tricuspid, and mitral. And in order for me to listen to her, to palpate her PMI, I would have her lay down on her left side. I'll have you lay down on your left side. If you can turn a little bit to me. And at this point, I will then feel for her PMI for her, since her heart falls to the side, to get a feeling for that. And that's what I would do. And that's strong. And so therefore, that's good in that regard. So while we're here, I'm going to have you go ahead and lay back on your back. So just lay down on your back. And I'm going to go ahead and, since I have her here right now, I'm going to go ahead and just inspect her abdomen. So if you mind, I'm going to just raise it up. And so what I know is that her abdomen is nice and smooth and flat. I don't see any stretch marks or any rashes or abrasions. And I don't see any hernias as well either. So I'm going to listen for any bruits. And for this, I will listen to the aortic, the renal, the iliac, and the femur. And then after that, I would want to feel, and I'm going to listen to a bruit up at the front too as well. I will go ahead and do that, listen to a bruit up here, her cardiac bruit as well. And I will also turn around, listen to, and turn on the bell as well too. That way I'm able to get both sounds to find that out for that. But while I've inspected her abdomen, then now I'm going to get ready to palpate and massage and find out, because when I listen to her bowel sounds, which I haven't done just yet, listen to her bowel sounds, which I'll do right now. Start with the right side and the left side, and go back again for each quadrant. And her bowel sounds are very reactive each way, which is good. That means that we have no problems. Your bowels move very well. You've never had problems with constipation or anything. Now I'm going to massage. I'm going to do light fingering, feeling. Any pain or discomfort? Now do more, deeper. Any pain? Pain? All right, so her abdomen is, like I said, is symmetrical, and also too, her bowels are reactive, which is also good. So then I'm gonna go ahead and have the Grace to sit up. And what I'm going to do with Grace is now I'm going to go ahead and tap on her back, because when I listened to her lungs, I didn't get a chance to do her percussion and check her excursion of her lungs. So what I'm going to do is I'm going to have Grace take a deep breath, and I want you to hold it. Okay, so I'm right here. So I know it's a difference, but right here you can release the air. Release, breathe. And now I want you to go ahead and breathe again. And then we'll try again. So I know that there's a difference between 3 about 3 centimeters. Usually the average range is between 3 and 5. So she's within range, which is good. Now I'm going to go ahead and check for her breathing of excursion. So I want you to take a deep breath in and out. Great, great. And now I'm going to test her tactile firmness. I'm going to put my hands here. And what you say, 99?
99,
99.
99.
Okay, great. And so I felt vibration, so that you're all within normal limits with that as well too. So that's good to know. Now what we're going to go ahead and do is we're going to also, now I'm going to pull this down right here for you. And what I'm going to do is now I'm going to check with your hearing. We didn't get a chance to do that a little bit. We looked in your ears already, which is good, but now we are going to check with the Rhine and the Weber test. This test helps to see whether or not how your hearing is, and with the bone conduction and air conduction. And generally, if everything's within normal limits, the air conduction would be a little bit more longer in that regard. So I'm going to strike it, and I'm going to put this right here. This is the Rhine test. Let me know when you hear it, when it stops.
No.
Okay, so that means that you're within normal limits with that. That's great. Now we're going to try the Weber test, okay? You hear it on both sides?
Both sides.
Excellent. So that means that your hearing is within normal limits as well too. That's good to know. And while we're here, I'm going to check your vibration, your sensations of it. So I'm going to your phone with promises. So I'm going to go here and let me know if you feel the vibration.
You do.
Okay, that's good to know. And let me try right here again. And this is right here.
You do.
Okay, that's good. Within normal limits is with that as well too. That's good to know. And now while we have that here, I'm going to check your reflexes too as well. So we were going to first check your brachial. Great, reflex. And I just want you to relax your arm. There we go. Great. And now I'm going to go ahead and put your arm right here. Are you comfortable?
Mm-hmm.
All right. No discomfort?
No.
Great. Good reflexes as well too. And then what I'm going to also try to do right here is I'm going to do the Babinski. And basically Babinski is only done with children. If your feet will fan, if your toes will fan, that means that there is something neurologically wrong and that we will have to get checked. So right here. Okay, that's normal. There's no response, so that's within normal limits. Now what I want you to do is I want you to close your eyes and I'm going to check for sensation here. And so what I would like you to do is I want you to tell me what you feel here.
Sure.
And what do you feel here?
Can you do it again? Oh, dull.
Okay, and how about right here?
Sharp.
And how about right here?
Dull.
Good, that's good to know. All right, we're good. You can open your eyes again. All right, so now what we want you to do now is I would like for you, we're going to check now as far as your muscle strength. And what I want you to do right now is I'll hold your arms like this. And so what I'm going to try to do is pull it from you. I want you to see if you can pull back. Great, great strength. And then I want to push your feet down. I'm going to hold it right here, push down. Awesome, good. And I want you to put your hands here. I want you to flip back and forth. No problems. That's good to know. And then I want to have you, apologize, have you put your hands on your face, and I want you to pull it that way. Awesome. And this way. No problem whatsoever. So your range of motion for her neck is very good too, looking both sides and both ways. All right, Grace. What I want you to do also too right now is we're going to go ahead and have you step up off the mat here. And I would like for you to turn this way. We're going to go here for the purpose of the camera. Right, this way. There we go. And I want you to hold your hands outward, please, for me, and close your eyes. Awesome. And how are you feeling with that?
Good.
Good. Now you can open your eyes again. And now what I'd like you to do, Grace, is I would like you to walk forward, take a couple steps forward. All right. And then turn back around to me. And walk your tippy toes. Any problems?
No.
Okay, great. And I'd like you to walk back over this way on your heels. All right, great. And then I'd like you to come back over to me, please. And heel toe. There you go. And then you're gonna turn around. Now I'd like you to just try to sit here. We try to see how much your balance is. All right, great. And I'd like you to try to put your foot here. Awesome, that's great. And you did a great job. Now I'd like you to have one more last time up here, and then we're almost about done. You're doing really, really good. I'd just like you to lay down. We're going to check your strength. And we'll pull this out here. Your range of motion. So you have not, I looked at her legs and I see that there's no issues with your knees or your hips at all whatsoever. So Grace, what I'd like you to do is first, since I've looked here, I don't see any abrasions, I don't see any problems. And you haven't had any problems with your knee? No pain or discomfort? Okay, great. So I'd like you to raise your leg up for me. Any problem with that?
Nope.
Okay. And so then now I'd like you to raise it and bend your knee at the same time. Okay, and now I'm gonna raise it and bend your knee as well. I'm gonna raise it. And I'm going to, just let me, check your range of motion over your hip. Inversion, exversion, okay, great. And I'll bring it back down. And then I'm gonna check your feet, inversion and exversion. Any pain?
No.
Okay, great. Let me have you go ahead and stand back up. And for this purpose of this video, I know that you're gonna have your physical exam for your genitalia. That's been deferred for another time. That'll be okay. But I think that, do you have any other questions for me that you might want to ask?
No.
Nothing, and no concerns or anything?
No.
Well, this ends our wellness check that we've had. I think that we've accomplished everything. I know we looked into your mouth and we had your tongue go back and forth and you had your head go back and forth and we went over all of our cranial nerves. Thank you for your time, and you'll be followed through again with your doctor.
Thank you.
Thank you.